Assalamu alaikum. I'm Dr. Lubna Ali and I have delivered the lecture on vaginal discharge. Now the questions I will now answer your questions. Assalamu alaikum. Ji Dr. Sadia. Dr. Sadia, the GPs can perform vaginal speculum examination. It's not a big deal. If you think that just the inspection and the history is not sufficient, then speculum examination can be done in outpatient department. And nowadays disposable speculum are easily available, plastic, which can be inserted and then you can see the inside of it. The pH of vagina is checked by special vaginal pH strips, but it is not available everywhere. But I think in foreign countries it is available. You can take as a doctor, you can take oral history. 50% of the diagnosis can be made on oral history by asking the type of discharge, the color and the symptoms. And if you think that you need to examine the woman, then you can have an inspection. Or if you think you need to have more, means you want to rule out cervicitis or infection of the cervix, then you can go for speculum examination as well. Ji Dr. Shabana. The pregnancy, the safest antibiotic during pregnancies are macrolides, that includes erythromycin, azithromycin, and even cephalosporin groups can also be given, but we avoid to give quinolones such as ufloxacin and doxycycline. These should not be given during pregnancy. The PID, normally during pregnancy, PID doesn't occur. The word should be the vaginal discharge during pregnancy, and the treatment will be same as I told you. The role of hygiene practice like bath products and talcum powder, they normally do not cause excessive vaginal discharge, but if you do excessive douching, so that will destroy the natural bacteria, so then it can cause certain problems. So it's better to avoid talcum powder. Excessive vaginal discharge in children, I think I've discussed this in my lecture, that if a child has come or the mother has brought her child with complaining of excessive vaginal discharge, you should first of all inquire about the hygiene, whether the baby takes care of her clothes or the washes after every time she goes to toilet, or what type sort of clothes she wears, whether it is cotton or it is synthetic, and whether she takes bath, and also take history if the mother has got discharge, because if the clothes are washed together, so that infection from the mother can also be transmitted to the baby as well. That should always be asked, as well as usually the babies have pinworm manifestation, so sometimes that is missed. Ask about the itching at the anal area, and especially at night. So if the baby is suffering or the child is suffering from pinworm infestation, so that can also cause vaginal itching and discharge. In children, usually streptococcal infection is the commonest cause of excessive vaginal discharge. So you can tell them all these things. If still they have complaint of excessive vaginal discharge, then you should also see or inspect her, and also rule out any foreign body. Sometimes that can also be a cause of excessive vaginal discharge. The trade name of medicines used in Pakistan regarding the PID, if you think of the doxycycline, it is available with the name of conchimycin and vibramycin. The flagyl is available with the name of flagyl, as well as with the name of Fesogen, that is 2 gram with the name. There are many type of flagyl is available, but you can, if you write flagyl, that can also be, you can have it. Erythromycin is available in the same form, and ufloxacin is available with the same name, and azithromycin is available with the name of Azomex, Macrobac, and Plazo. The external application of imidazole cream can only will cure the irritation or the itching associated with the vaginal discharge. If somebody has got mild vaginal candidiasis, and if she thinks that if you think that she doesn't need pastry, then simple application of the vaginal cream may be sufficient. That is local application. But if she has got vaginal discharge, then ideally at least a single dose of antifungal vaginal pastry should be given. The treatment of chlamydia, I think I've mentioned in my lecture. You can see from that. Yes, if you think that the child has had sexual interference or sexual abuse, so first of all take proper history from the attendants. Many times the attendants do not give history, but if you think that there are signs of interference or there are signs of bruises, or you suspect that there may be sexual interference, then ideally the baby should be sent to a particular hospital which have got the medical legal facilities available. And if you want to do any specific test, you can simply test the swab. Swabs can be taken from the urethra, from the vaginal area, from the anal areas. That is sufficient for you people. Examination of a child, vaginal examination should not be carried out. You can only do inspection, and if you think that this is important or you are suspecting any hematoma or anything else, then that has to be done under anesthesia. And if a pubertal girl, like 15-16 years old girl, she's got a mass and you want to check her, then you have to do rectal examination, not vaginal examination. Atrophic vaginitis may present with vaginal discharge, and usually you should rule out any pre-malignant conditions, such as you can test her for the vaginal swab can be done, and you can also see whether pap smear has been done for this particular lady previously or not. And if it has not been done, you should do it and treat her with estrogen cream, which is available with the name of Premarin. So that will benefit the atrophic vaginitis. Cervical ectropion is basically the inside, that the cervical gland or cervical cells, they grow outside the cervix, so they look like pink. So when we do speculum examination, we see the pink area. That is basically the cervical lining of the cervix that grows out. So it may be columnar cells and they look pink. So ideally they shouldn't need any treatment, but if the patient is complaining of excessive vaginal discharge which is not treated on your medicines, then you should go for speculum examination and see that she has got an ectropion or not ectropion. And you can treat her, or if you can send it to consultant, because sometimes we need to cauterize with the silver nitrate, or sometimes pottery is done. So I think that particular patient should be sent to a specialist. PID predisposes to ectopic pregnancy and infertility long term. PID is basically the inflammation of the upper genital tract, like tubes, causing salpingitis, like ovary, uveitis, then even peritonitis. So that will be a long-standing case. So if a woman is having any sort of vaginal discharge and then leading to PID, then ideally that should be treated. Otherwise, in the long term, she will be having salpingitis, which can cause the and of course or damage to the tube, and that can be a cause of ectopic pregnancy and infertility. Hysterosalpingogram, if it is done in a proper way, in a proper sterilized way, it usually doesn't cause PID, but it can cause PID if it is not done in proper sterilized way, or if the woman is already suffering from infection or she has got vaginal discharge. So ideally she should be treated before undergoing hysterosalpingogram. The vaginal discharge should be treated, and then she should go for the hysterosalpingogram. That is important. The doctor should always, when the doctor writes a prescription or investigations, she should always ask the patient whether she is suffering from vaginal discharge. So that should be treated before she goes for this investigation. Yes, the difference in medical treatment of acute and chronic. If the patient has got acute symptoms, that means she has got acute and excessive pain, then you can treat her by intramuscular injection or parenteral injections. She can be admitted. And for the chronic PID, of course, then the same old treatment and the painkiller, and sometimes you ultrasound, and you can do nothing for those patients who have chronic PID. एक मिनट मैं रुक जाऊँ यहाँ पे. Dr. Nilufer, MC criteria for bacterial vaginosis I have already described. So you can check the microscopy if the facility is available, if you've got the slides at your place with a speculum or with a you can make the slide and see under microscope, but most of the time we don't have microscope available in our outpatient department. So you can send, or you can write down the prescription and send the patient to laboratory for microscopy, so that you will at least be knowing the diagnosis. Gonorrhea may be common in Pakistan, as in UK. I can't say we don't have all the, you can say, the numbers, or it is not being checked as such, but it is there. Gonorrhea is there, but I can't say whether it is as common as in Pakistan. It is very difficult to say how to treat chronic pelvic pain or PID after you have done the surgical treatment and given antibiotic, because these patients usually they have to live with the pain. So you need to give them analgesics on and off, and sometimes we give them antidepressants as well. And psychotherapy is important for them because it may be psychological as well, but maybe due to adhesions which are still inside. But then depending upon the surgical treatment, you have to tell them what probably they have. If they have got the dense adhesions which cannot be removed, then of course they keep on having pain. If the patient is taking treatment for bacterial vaginosis, ideally when the treatment is given, we tell them to avoid intercourse, because of course if someone has infection, that can be transmitted to spouse, and you should tell them to avoid relationship for at least a week to 10 days. If you will not treat the candida, the complications, usually the patient will suffer from severe itching and redness, itching, and even dysuria, and sometimes this dysuria can lead to urinary tract infection. If the urinary tract infection persists, that can lead to cystitis, and in the long term she can have the pyelonephritis as well. But simple candida will not do it, but basically local problems will be more. If an unmarried girl is complaining of diphtheria, then you should always ask the history, that whether this has been present since 10 years, so whether it has got some relation with anything, either it is related with the onset of menstruation, or after the menstruation finishes, then she has this problem, or when she's under stress or has heavy work, then this is the cause. Because if that is a normal vaginal discharge, physiological discharge, you simply need to reassure her. But if it is associated with smell and itching, then you need to treat her. And she has weakness and fatigue, but the dichordia doesn't cause physical weakness and extreme fatigue. That may be another problem. So you need to go for certain tests, check her CBC, hemoglobin level. Maybe she's anemic, maybe she has got calcium deficiency, maybe she's having vitamin D deficiency. So you can go for other investigations. If she's not anemic, okay, you can give her antifungal. You have already given her, that is causing temporary relief. Then you have that, maybe that means she has got a recurrent infection. That means if a woman or a girl has infection at least 4 times a year, that is called as a recurrent infection. Then you need to tell her about the hygiene, about the clothing, washing of her clothes, and even means it should not be mixed with others. And maybe check if she's using the toilet seats, so that can be a source of infection. Or you can then go for the test as well if you think that is necessary. If the woman has got simple vaginal discharge and backache and lethargy, and there is no pelvic tenderness, ideally you should have an ultrasound done, as well as you should go for the X-ray of the lumbosacral region and check whether she is having again anemia or calcium deficiency or vitamin D deficiency. The diagnosis can be vaginal discharge, or if it is she is having lower abdominal pain, although no tenderness, then you can think of PID as well. So for the PID, you can go for the ultrasound, and for the foul smelling vaginal discharge, you can go for the investigations. For the swab test, you can go, and then you can give the treatment accordingly. Yes, you're right. I think I should have added some pictures as well. Okay, next time, inshallah, I will do that. And regarding the newborn, I think I mentioned it in my lecture that the newborn babies, if they have got bloody stained discharge, that is related to the maternal hormones, estrogen and progesterone. So many times under the influence of these hormones, when the newborn baby is born, they have slight bleeding. Even sometimes they have got discharge from the breast as well, and the mother is very anxious. So the reassurance is the only advice, and usually within a few days this disappears. It is not important to carry out investigation in all cases. If on inspection you can diagnose that she has got a candidal infection, then you can treat her empirically. And where you are suspicious or the patient is willing to have investigation done, then you can carry out the microscopy, a simple test especially for the candida. In bacterial vaginosis, no need to give both the treatments simultaneously. Ideally, topical treatment is better than the oral. If the woman doesn't benefit from the topical treatment, then you can give oral treatment as well. Like topical means the metronidazole gel, and if that is not available, or if the woman doesn't want to have a topical treatment, you can give her oral treatment as well. That is a brownish vaginal discharge, then you have to see whether she is having some cervical pathology. You should go for the first speculum examination. Maybe this is cervical pathology, or maybe this is related to the menstrual cycle. Should do a first speculum examination and an ultrasound to see where is the problem. As a GP, you can treat these infections, the vaginal discharge, at your own, of course. If you know the knowledge, you know the diagnosis, you can take the history, you can even inspect her, you can do the speculum examination, you can treat her. But if in spite of giving treatment they do not benefit or they still have problem, then you can refer them to consultant. The treatment of vaginal discharge during pregnancy usually candidal infection or bacterial vaginosis is more common. So then according to the type of discharge, you can treat them. The almost same treatment, only doxycycline and the quinolones are not given during pregnancy, and in the first trimester try to avoid giving any antibiotic orally. Oral antifungals are not given during pregnancy. It's better to give topical or the vaginal creams, and if usually they benefit if they are taken properly. And if they do not benefit, the patient constantly have the problem, then sometime in resistant cases you can give oral antifungal. But try to avoid them during pregnancy. You can give azithromycin, you can give erythromycin, and all the imidazoles can be given topically. Vulvitis, you can give the cream, local cream. That is, canesten cream is available, that can be applied locally. And if the discharge is along with the discharge, you can give the local cream as well. Of course, you need to add antibiotic if you know the type of discharge, you should add antibiotic. Free fluid seen in cul-de-sac means there's an infection in the pelvis. So many times this finding will be seen in ultrasound. So that indicates the infection. The management will be the treatment of PID. Infection means the infection of the upper genital tract. So you need to treat the same treatment, the PID treatment. Yes, PID is basically a disease of sexually active women. But in unmarried girls, this can occur if suppose she has got other pathology. Maybe she has a rupture of appendix. Maybe she has an abscess of the appendix. That can tubes are very nearby, the ovaries are nearby, so in that cases they can have infection of the upper genital tract as well. But basically, when you talk about PID, that is a disease of sexually active women. Yes, barrier method do protect against STDs. They say that is what infection basically. Many women may have allergy to hygiene methods. They feel irritation or itching after that, so you should rule out the vaginal infection, vaginal discharge. Maybe that is the reason, or if that doesn't suit them, then they should change the type of the quality, maybe not good, so that can also be checked out. You don't there's no need to treat the partner in candidiasis. Only if you think the patient, the husband, spouse has got the itching, when the woman had this problem, then you need to treat them. Otherwise, they don't need to treat spouse. It's better to avoid flagella in the first trimester. Fluoxetine for gonorrhea, they say single dose is sufficient, but if you think that the infection is more, all the treatment options are good. I can't say which is the best for the patient. That depends upon how much is the infection, mild, moderate, or severe. In severe cases, you should give the injectable ones, but in the mild cases, you can go for the oral ones. If the patient refuses to go for the test, you can take the history. 50% of the diagnosis can be made on history, so you can take the history, or simply you can inspect the vulva for the discharge, or if they still refuses, you can take the history, and then that will tell you about what type of discharge she has, whether it is bacterial vaginosis, trichomonas, and whether it is gonorrhea or whether it is candida. So you can give empirical treatment. No, I don't think so. Any diet will keep the vaginal secretions normal. But no, I don't think so. Calcium containing food or disuse of yogurt will lead to this thing. That is, I think, a myth. The treatment of excessive normal vaginal discharge, I don't think so. If the patient, this is a physiological discharge, and there's no need to treat them. Again, the hygiene, keeping the hygienic conditions and changing of clothes, underclothes, this is important for them. And still, if they are worried about them, then you can give them empirical treatment for the vaginal discharge, or you can send the vaginal swab. The gold standard investigations for the STDs is, of course, the vulvovaginal swabs, which should be sent to the laboratory. But if you're suspecting STD, ideally this patient should be treated in the genitourinary medicine clinic. That is, most of the time, like we have in civil hospital, we have got a STDs clinic. So if we suspect the woman is suffering from gonorrhea or syphilis, then we can send them to STD clinic, because then in these cases you have to take the history of the partner as well. Most of the time, the woman may not be telling you the correct history, or they may not be knowing about the husband's history. So then, if you are suspecting, the both partners, the both husband and wife, should visit the STD clinic so that they can take the swabs and send them for the test. Yes, you can do wet smear if the facilities are available. That means you need to have a slide and a spatula. If you have the facilities and the microscope, you can see it directly under microscope. Hyvaginal test, hyvaginal swab is very easy. You can write down to the patient that they bring this tube from the laboratory. They usually bring, and then you can take it hyvaginal swab easily, and then tell them to give it back to laboratory. It's not necessary that dyspareunia is indicative of PID. Maybe the dyspareunia can be caused by endometriosis, maybe vaginal discharge, maybe PID, maybe some other problem. So you need to have differential diagnosis. You need to take proper history and examination. Then only you can say what is the diagnosis of that particular patient. Not all PID is related to STDs, not necessarily. I think I've answered that as well. And most of the time, the most common organism responsible for PID is chlamydia. IUCD can lead to PID, of course, if it is not inserted under proper sterilization. So many women have got vaginal discharge, and if that vaginal discharge is not treated, then sometimes they have PID. PID means simple upper tract infection. and vaginal discharge is lower tract infection. Usually in pregnancy, PID doesn't occur. The word during pregnancy is vaginal discharge. During pregnancy, the woman has vaginal discharge. For STDs, again the same test. You can go for the chlamydia. The test is that you can go for the nucleic acid amplification test if it is available. So you can take the swabs and send it for that you confirm the type of STD, and or other way you can send the patient to the STD clinic. The diagnosis of PID is of course basically on history and examination, and for you can go for an ultrasound as well to see if she has got any other problem. Maybe she has got an abscess, maybe she has got some cyst or adnexal mass, but basically it is on history and examination. Yes, exercise, yes. Sometimes with exercise there may be excessive secretions that may be due to the secretion of the cervical gland. But vaginal discharge is physiological or it can be pathological. So you need to differentiate whether it is physiological related with the exercise or it is the pathological discharge. Excessive physiological leukorrhea in women, the only thing is reassurance and again the hygienic practice. Otherwise, you don't need to treat the physiological leukorrhea in girls. The bone pains and muscular pain, they are very common in patients, in young females, even the elderly, because we don't have proper intake of water, the vitamin D deficiency, so you need to go for the tests, check her vitamin D levels. And many women, they have myths that if they've got vaginal discharge, that is why they are having bony pains, muscular pain. So you can add them calcium and go for the vitamin D testing. If that is deficient, you can add vitamin D. Fluconazole and imidazole, the name. The most commonly used antifungal is canesten, which is the clotrimazole. Fluconazole is Zolinex, capsule Zolinex is available, and the dose is 150 milligram, 3 tablets, one at day 1, day 4 and day 7. Itraconazole is available with the name of, there is another antifungal, it is also available, but Zolinex is quite efficient in that. If the woman refuses to have topical cream, then you can go for the oral fluconazole in that patient. Yes, in the first trimester, try to avoid giving oral metronidazole. Topical metronidazole gel is available. Previously it was available in Pakistan as well. Nowadays it is not available, but that is better to prescribe that in first trimester as well as in other trimester, but in the second and third trimester oral treatment can also be given. You cannot see candidiasis, yellowish white fall smelling discharge. So in candidiasis, it is usually curdy type of discharge. So you need to rule out bacterial vaginosis or trichomonas. Until unless you do the inspection and see her properly, you cannot say it is candidiasis. Chandelier sign is when you do the examination of a patient and she pops out of the bed while doing examination, that is known as chandelier sign. In those who have contraindication to cephalosporin or quinanon, we can give azithromycin, that is can be given in the PID, and you can give the doxycycline as well. I think I've mentioned the leukorrhea and the treatment during pregnancy and after menopause, that is already, I think I've mentioned it. A woman having clear egg white like vaginal discharge, that means maybe she's got some discharge along with urinary problems. So try to rule out UTI by going for the urine analysis and see if she's got any infection in the urine. That should also be checked out, and how much discharge she is having. Ask about the itching, about the smell, and then accordingly you can treat the type of vaginal discharge. The cause of dyspareunia I've discussed. It is maybe related with the infection, maybe endometriosis, maybe some other pathology of cervix, so that should always be checked out. And of course, slight discharge does occur after intercourse, and that is normal. But if it is associated with smell, or she has got dyspareunia, or she has got itching, then you should check her, go for the first speculum examination, and give the treatment accordingly. Dr. Mariam, I think I've answered this question previously, the physiological cause about this. And the discharge doesn't cause loss of calcium. Non-symptomatic partner, yes. If you're suspecting bacterial vaginosis, ideally you should treat the partner as well, even the partner is non-symptomatic. And very easy to treat. It's 2 gram flagell. It's not a big deal. You can get them for 1 day. For microscopy, simple microscopy, you can go for the microscopy. You put the slide, you put the discharge on the slide, and you can see in the microscopy regarding vaginal swab. When you have to write to the laboratory that give vaginal swab to the patient. The patient brings the vaginal swab, and then you have to take the discharge on the swab and put it back in the tube and send it to the laboratory. That's all. For the patient to specialist if she has chronic vaginal discharge which is not being treated by your treatment, or you think that some other cervical pathology, or you are suspecting some cervical malignancy, then ideally the patient should be sent to specialist. Again, this is, I think most of the time, this is a psychological problem. They do have this physiological discharge, and you're going to do simply reassure them and tell them again about the hygiene practice and all this thing. Reassurance is the only answer to these patients. This depends upon how much problem the woman has got. If you think that she's got a pathological vaginal discharge, excessive vaginal discharge, then ideally you should go for the speculum examination. And if the woman refuses for going for a speculum examination, then you can treat her empirically. Yes, cervical tenderness and adnexal tenderness is that when you're doing for bimanual examination in a woman, and when you touch the cervix and she feels pain, that is known as cervical tenderness. And if on doing bimanual examination, the fornices, she has pain in the fornices, that will tell you about the adnexal tenderness. Adnexa means that the ovary and the tubes both. Referral books is the Gynecological Gynae by 10 teacher, the latest edition, the Oxford Handbook of Gynae and Ops and Gynae in evidence-based text. So thank you very much for your questions, and if you still have any questions, any queries, we can carry out in another session.